Hi, my name is Daniel Lord and this is my airway skills video. In this video I will demonstrate the lateral position, triple airway manoeuvre, insertion of an oropharyngeal airway, nasopharyngeal airway, laryngoscopy and bag valve ventilation. This video is filmed on the 27th of the 9th, 2013. Demonstrate the lateral position. Position yourselves at the patient's hips and check their pockets for sharps. This is a common error as trauma can occur. Bend the near knee up, extend the far arm out at the shoulder and flex the near arm across the chest. From the hip, shoulder and the hip, roll, maintaining the neutral alignment of the spine. Extend the far knee up to the head and extend this arm out away from the airway. Head tilt the patient in a downwards action so that free drainage can occur from the mouth. Look, listen and feel for breathing and monitor the patient. Now demonstrate the triple airway manoeuvre. Position the patient supine with a small pad underneath their occiput. Inspect the airway and if any obstruction is seen, use the suction equipment. Place one hand above the forehead with your thumb pointing towards the nose and your other hand on the point of the jaw. Gently extend whilst lifting the jaw. This is a head tilt and chin lift. Place your thumbs on the zygomats and your other fingers around the angle of the jaw and protract the jaw at 90 degrees from the pharynx. This is a jaw thrust. A common error of this skill is overextending the head. The triple airway manoeuvre differs from the sniffing position, as the sniffing position is a one-step process involving only a head extension. Now demonstrate the insertion of an oropharyngeal airway. Position the patient supine and make sure that the airway is clear. If obstructed, perform manual clearance. Select the appropriate size oropharyngeal airway by measuring from the corner of the mouth to the angle of the mandible. Then lubricate with the patient's saliva. Insert with a natural curve facing upside down, so halfway, then rotate 180 degrees and insert fully. Maintain triple airway manoeuvre and the position of the OPA. Look, listen, feel for breathing. If at any time there is a gag reflex, remove the OPA as the patient can protect their own airway. A common error is that the lip gets caught between the OPA and the teeth. This was the OPA. Now demonstrate the insertion of the nasopharyngeal airway. Position the patient supine and attempt manual airway clearance if appropriate. Select the appropriate size. This is done by measuring from the corner of the nostril to the earlobe. Once done, lubricate with KY jelly at the distal end. Select the widest nostril and gently insert up to the eye. Then go to 90 degrees and rotate at 45 degrees until the flange rests against the nostril. Maintain triple airway manoeuvre. Look, listen, feel for air movement and then maintain the position of the NPA. A common error is to have the NPA with the natural curve facing up toward the eyes instead of running along the floor of it. If the NPA becomes obstructed at any point, remove and insert a new one. Now demonstrate the laryngoscopy. Position yourself behind the patient with the patient in supine position. Make sure there is a small towel or pillow underneath their head. Suction equipment to the right, laryngoscope to the left. Make sure that the bulb is secure and that bulb is on. Right head extension and jaw support, and with your left hand, thumb down the handle, insert in the extreme right hand side of the mouth. Inspect the oropharynx for any obstruction and slowly move the blade further in, keeping the tongue on the left side of the blade. Gently lift up and inspect the vocal cords for any obstruction. The blade should be sitting in the vallecular groove. A common error of this skill is not checking that the bulb is secure and losing the bulb in the patient's airway. I'll now demonstrate appropriate bag valve mask ventilation. Position yourself behind the patient, making sure that the airway is clear, they're in a stable supine position and an oropharyngeal airway is inserted. Select the appropriate bag valve size, in this case an adult. Apply the face mask using the rigid face mask technique. Ventilate at 12 breaths per minute using the formula of 10 mils per kilogram. I'll now demonstrate this. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. A common error of this skill is inflating the stomach instead of the lungs.